Hi everyone, I am Dr. Krishna Chaitanya, consultant spine surgeon in KIMS Hospital, Kondapur. Here we deal with very advanced spinal deformities, particularly in children. Can scoliosis be managed without surgery? Definitely yes. If you take 100 patients suffering with scoliosis, more than 60 to 70 does not require surgery. The only thing which is important in these is identification at an early age. For example, if you take child with an idiopathic scoliosis and the curve is in between 10 to 40 degrees, usually they get better with a brace. But the main thing here is the brace has to be put for a longer time and the brace has to be managed very properly. Almost for 23 hours a day, the brace has to be worn and sequential x-rays has to be taken, and we should see if the brace is working or not. What actually is the goal of scoliosis surgery? For example, if you take any deformity, any scoliosis, if the growth phase is over, that is around 22 years of age, the curve must be less than 60 degrees. According to Scoliosis Research Society guidelines, if the curve is more than 60, then it independently grows. Even if the growth of the child is finished, the curve grows 1 to 3 degrees every year. That means at the age of 50 years, the curve will become 100 degrees. So our target is to attain a curve which is less than 60, possibly less than 50 by the age of 22 where the growth is completed. So for this, if the curve is less than 10, we just observe. If the curve is in between 10 to 40 degrees, we give a brace. This is the most crucial time where we need to identify the child, so that with the brace alone it can be treated and they do not require surgery. But at the age of 14, if the curve is already 40 degrees, that is very evident that by the time the child finishes his growth, that is around 22 years, it would have crossed 60. So there is no other option except to operate these children and make them straight and make them better than what they are before, so that their lung matures properly, their heart function is proper, and other internal organs are proper, and also definitely cosmosis, which is also very important at this age. So that is the reason we need to operate them. So it's a better the earlier we identify. But even then, even if sometimes we may not identify at a younger age, we have excellent treatment options for scoliosis. But if you ask me, it can be managed without surgery, definitely yes. Majority of the children can be managed without scoliosis. The only catch here is to identify it at early age. Thank you very much.